Hello, my name is Dmitry Karakovsky, and today I will be giving a presentation about the profession of a surgical technician. Many people want to pursue a career in the medical field, but are unsure where to begin and are not aware of the many professions that exist in this field. People are familiar with the basic professions such as doctors, nurses, and anesthesiologists. However, there are far more possibilities in this field that are not familiar to those attempting to pursue a medical career. One such profession is that of a surgical technician. The surgical tech profession started in the military in England back in the early 1900s. During this time of war, there was a major shortage of nurses and medical personnel. However, women were not allowed on battleships nor on the battlefield. This forced the men to perform all the medical duties in assisting the surgeon during critical emergencies. From this, a new, male-dominant profession was born called the operating room technician. After the Korean War, the shortage for nurses still continued. Hospitals were desperate for medically trained personnel, so they started to hire men that were coming back from the war to help assist at the hospitals. One of the first people to be recognized as a surgical technician is a man by the name of Mr. Rampley. He worked in a hospital in London, England. There are a few things that one must look into before they decide to pursue a surgical tech career. Some of the things may include salary, the training that one must go through, demand of the position, places that one can work, and the responsibilities that come with the job. Many people don't know that not all jobs in the medical profession require attending college 48 years. This is one of the many benefits of attending a surgical tech program. Technicians in this program may receive their training from a formal program offered by a community or junior college, a hospital, or even the military. All of such programs last for a minimum of 9 months and go up to 24 months, and can lead to an associate's degree, a diploma, or a certificate. Some of the classes that one must take in order to attend any of these programs listed above include Anatomy and Physiology 1 and 2, Medical Terminology, and Microbiology. For the amount of education and training that this job requires, it pays very appropriately. The starting salary for a surgical technician ranges from $38,000 and goes up to $51,000. A person's salary depends on a few variables, such as the medical specialty, which is a surgical technician's choice of sole subject in their career. This can include orthopedics or vascular focus of practice. Other things may include the geographic location of employment, the experience that the person has had in the profession, and if he or she is certified. Certification means that the person has taken the national certification exam, which may increase the individual's income annually by an estimated $10,000. Job security for this profession is also in the worker's favor. It is reported that employment for the surgical technicians is expected to grow faster than any other profession through the year 2014 as the volume of surgeries increase. Jobs should be easy to come across due to the fact that surgical procedures are expected to grow with the constant increase in population and the constant and inescapable aging of the patients. Hospitals are not the only places that employ this type of profession. This profession may also be found in a physician's office, dentist office, outpatient care center, surgery center, and hospitals. When there are some technicians that are known as private scrubs, who are employed directly by the surgeons, who have special teams for operations such as transplants. Techs are members of the operating room. The surgeon, anesthesiologist, nurse, and the surgical tech must work together to make sure the surgery is a speedy and a successful process. Each person in the operating room have their own duties to complete in order for the surgery to go smoothly. The duties of a tech are to prepare the operating room by setting up all the surgical instruments, all of the drapes, and the solutions. They must help prepare the patient by washing and disinfecting the incision site, help transport the patient into the room and assist in positioning them. They have to dress the surgeons in gowns and gloves. Techs also monitor a patient's vital signs and check the charts. The main job of a tech is to pass instruments and other supplies to the surgeon and his assistant and hold retractors. They also must keep account of anything that can get lost during surgery, such as needles, in order to prevent instruments from being left inside the patient. If anyone is unsure what they want to pursue in life, but are interested in the medical field, I strongly suggest that they look into the Surgical Tech program, which Bergen Community offers as a 9-month certificate program. There are prerequisites that must be completed before you can proceed with the training, such as Anatomy Physiology 1 and 2. The profession of a surgical tech is very involved, diverse, and is full of many tasks and responsibilities. It is an amazing starting salary which is difficult to come across. The prospects of this career are endless and job security is strong. I hope this presentation has enlightened you about the career opportunities offered by a surgical technician position. Thank you.